Hello, check. invite Dr. Satbir Khalsa, and because of him I'm able to see some important faces who have mattered in my life. My former mentor Dr. Prabhakar, Mr. Bala Muruganji, Dr. Indu Verma, Dr. Santram, Dr. Alka and many more, Dr. Gaurav. Thank you for coming. We'll get started. It's going to be a very enlightening and nice presentation. Dr. Satbir Khalsa is a dear friend who met me about 7-8 years back in Pune in an ashram called Kaivalya Dham, and then later in Patanjali Research Foundation in Haridwar. And he's been also a big influence on my own ideas about how to take neuroscience forward. He's been engaged in biomedical research on the efficacy of yoga and meditation in various dimensions. He started practicing what is called Kundalini Yoga 1 year before I was born, so 54 years back. So he's a certified trainer of Kundalini Yoga. He's also the director of research for Kundalini Research Institute and also serves at Benson Henry Institute of Mind-Body Medicine, as well as at the Harvard Medical School as the associate professor. He runs many yoga programs around the world and is highly respected domain expert. And he sent me a list of topics of what he could talk on. One was just on yoga and meditation, the impact on health, on psychology. And I thought this one was the most relevant one that caught my attention. I thought this would be more relevant to my colleagues, especially in the clinic and paramedical and also the research settings. He is the chief editor of the medical textbook, now actually very well cited and very famous, called The Principles and Practices of Yoga in Healthcare. And among many, many other positions he holds, as task force member, as committee member, the thing that is most closest to my heart is his most humble personality. And at this age also, he's very actively involved in research and in promoting the science and research of yoga. So without much ado, I will request Dr. Satbir to please take over and explain to us what your experience of research and science on yoga tells us with relation to sleep and insomnia. Thank you.
Well, thank you, Akshay, for that kind introduction, and thank you to PGI for hosting me for this seminar. I'm most grateful to be here and to share what I know about the field of sleep and then also the impact of yoga on that. I've been in the field of sleep and circadian rhythms research since 1985. So I have a good deal of knowledge. I'm based in the Division of Sleep Medicine at Harvard Medical School, and so our division has been at the forefront of many of the leading advances in sleep medicine. So I want to start my presentation with some knowledge about sleep, and I think this cannot be underestimated in my view. What we are learning about sleep is that it affects virtually every function in the mind and the body, and this has been underappreciated in modern society, and we are paying consequences for that misunderstanding. So sleep, there are a number of characteristics that need to be emphasized. Number one is that sleep is a biological need. If you violate that biological need, there are consequences, and I'm going to share with some of you what those consequences are. In the field of sleep medicine also, it's not just important to know what happens during sleep, but also what's happening during wakefulness, because the quality and quantity of your sleep is going to affect your wakefulness during the daytime. So in the field of sleep medicine, we are also concerned about alertness and wakefulness. Another feature of sleep is that it's an active process. In fact, in the 1800s, it was believed that during sleep, everything just turns off. And that's not the case. Sleep is a very active process. In fact, you know this when you have a dream. It's sometimes hard to distinguish between real life and a dream when you're having a dream, and the brain is extremely active during that phase of sleep. Finally, it's an extremely complex process. In terms of the regulation of sleep itself, it involves many nuclei in the brain. The number of neurotransmitters and nuclei involved in the regulation of sleep is really complex. Not only is it with respect to sleep, it's also with respect to biological timing, the circadian clock that we have endogenously in our brain. And the circadian clock and our homeostatic sleep drive contribute to the quantity and quality of sleep. There are two sort of major issues in terms of society and the consequences of sleep or sleep deprivation that are present in society. One of these is so-called sleep deficiency. And this is very simply stated, not getting enough sleep for one reason or another. And the other one is the inability to initiate or maintain sleep, which is commonly known as insomnia or sleep disturbance. So I want to address, even though my topic is not going to talk about yoga and sleep deficiency, I did want to address this topic because it is of global importance. It is perhaps one of the largest problems that we face. And we know that in the field of sleep medicine, we have quantified what sleep need is. So this is a consensus panel of all of the leading yoga researchers, all of the leading sleep researchers with respect to sleep need. And very clearly, it's been stated adults should sleep 7 or more hours per night on a regular basis to promote optimal health. And we've also been very active in our division of sleep medicine in terms of this idea of sleep deficiency and the consequences of sleep deficiency. And this is a list of some of these consequences, and they are not insignificant outcomes. So in terms of behavioral impairment, it's impairing alertness, reaction time, mood, accidents, executive cognition, learning, memory, immune function, alcohol use, and appetite changes. And these are all significant changes. Furthermore, and more seriously, it is a major risk factor for many of the non-communicable diseases that we are facing at epidemic proportions, and that includes obesity, diabetes, heart disease, stroke, hypertension, depression, anxiety, stress, cancer, and even mortality. So this is not a trivial list of consequences of sleep deficiency. Now, these are statistics from the United States. On the left-hand side, you can see this graph. There are two dates portrayed here. This is the percentage of people who are sleeping less than 6 hours per night on average. And what you can see is that in 1985 is about 23%. It has risen to close to 30% in 2012. It's getting worse. And these are more recent statistics. This is a slide going from 2004 to 2017. You can see the general increase in the population, the percentage of people that are getting less than 6 hours per sleep. And I can tell you that these people are walking around with chronic sleep deprivation, at risk for all of those diseases and consequences I just showed you in the previous slide. The problem is international. The problem is here in India. So this is a survey by local circles showing that 59% of Indians surveyed get less than 6 hours of uninterrupted sleep. And what you can see from this statistic in 2022 going to 2024, it's increasing continuously. So clearly, despite the activity of my colleagues in the field of sleep medicine, we are not having as much of an impact on society to curb this negative trend as we might be doing. So let me now turn to the second major disorder, which is this sleep disturbance, the prevalence, characteristics, etiology, and treatment of difficulties with sleep and sleep onset. And insomnia prevalence, these are statistics from the US. Approximately 10% of the adult population suffers from an insomnia disorder, and another 20% experiences occasional symptoms. Older adults, women, and people with socioeconomic hardship are more vulnerable to insomnia. Insomnia is often a chronic condition with a 40% persistence rate over a 5-year period. Insomnia is highly prevalent in clinical practice, occurring in up to 50% of primary care patients. And these are statistics from the US. The statistics from India are very similar. In this local studies of separate populations in India, in one study, in this study cohort, 18.6% reported insomnia. Insomnia is an unrecognized burden in India and underscores the need for community-based studies across different socioeconomic situations. And below, in terms of medical comorbidities, chronic insomnia was seen in 33% of the adult population sampled, and these are patients. So patients are at more risk of having insomnia. And insomnia, as I said, affects virtually every function of the body. So from this model, you can see medical illness, it's a two-way street. Insomnia is a risk factor for medical disorders, and medical disorders often have insomnia as a comorbidity. Same for psychiatric disorders. insomnia is associated with cognitive impairment, higher healthcare costs, increased accident risk, absenteeism, and reduced quality of life. And from these papers, it was concluded insomnia can present independently or alongside other medical conditions or mental health disorders, and is a risk factor for the development and exacerbation of these other disorders if not treated. Insomnia is a significant public health problem that should be addressed at the individual level with appropriate clinical care and at the population level with large-scale sleep health interventions. And there's a big movement in the US by the sleep medicine and research community on trying to educate the public about the importance of sleep and insomnia. So the insomnia diagnostic criteria typically are requiring that there be a sleep onset latency, a time taken to fall asleep, which is typically greater than 30 minutes, or being awake in the middle of the night for greater than 30 minutes, and the frequency should be at least 3 times per week. There should be a duration of at least 1 month, and there should also be an associated significant daytime impairment or consequence as a cause of the insomnia. And that then is distinguishing what we would say is clinically significant insomnia from subclinical insomnia. And as I said, virtually everything affects sleep and therefore insomnia. So psychiatric or psychological factors, in fact, one of the defining characteristics, the diagnostic criteria for depression is a sleep disturbance. Medical and neurological factors, including pain, are associated with insomnia. Medications and substances can interfere with sleep, such as circadian factors, jet lag, shift work. Environmental factors, of course, will disrupt sleep if you're in a noisy environment with constant light. And then primary to sleep disorders, such as restless leg syndrome or even sleep apnea can manifest as a disturbance in sleep. So these can all be there and they can be temporary. But what often happens when these conditions persist is that you start to see something else come into play. You start to see behavioral, psychophysiological, and conditioning factors appear. People develop fear and frustration with their insomnia. They start to adopt sleep-incompatible behaviors and generate increased arousal, which itself starts to impact the cause underlying insomnia. So now these factors are contributing to the insomnia. In fact, what often happens is that these originating circumstances may fade or pass away, and the patient is left with what we call primary insomnia. It's there all by itself. Those precipitating factors that cause the insomnia in the original situation are gone, and now the patient just has insomnia with no explanation for why he or she is experiencing that condition. So insomnia treatments come in several varieties. Secondary insomnia is basically treating the original cause if it's still there. So if a patient has chronic pain, depression, anxiety, sleep disorder breathing, or another sleep disorder such as restless leg syndromes, you treat that, and hopefully that's the underlying cause and the insomnia goes away. For primary insomnia, where there's no obvious secondary cause responsible, there's pharmacological treatments and behavioral treatments. And what I'm going to really focus on today is behavioral treatments, because I think pharmacological treatments have a lot of negatives associated with them. The biggest problem I have with them is they don't really treat the underlying cause of the insomnia. And what we want to do in medicine is treat the underlying cause for a true cure. Behavioral treatments do address these factors, and behavioral treatments in conventional psychology have become very rigorous. They incorporate multiple different strategies to help with sleep. Sleep hygiene, which includes positive recommendations for facilitating sleep. Stimulus control addresses the association or reassociation of the bed, in other words, conditioning factors. Cognitive behavioral therapy addresses dysfunctional beliefs and misperceptions as well as negative and dysfunctional thought processes. Sleep restriction can be used to use sleep drive or homeostatic drive to improve sleep quality. And then relaxation treatments can be employed to reduce both cognitive and or somatic arousal and tension, which we believe has a contributing factor to insomnia. So cognitive behavioral therapy for insomnia is extremely effective. The problem is that it's not generally available and it's not generally known in the field of medicine. So therefore, it is underrepresented as a treatment for chronic insomnia. From this review paper, there have been decades of research studying behavioral and psychological treatments for insomnia disorder in adults, and several recent international guidelines have recommended CBTI as first-line therapy for patients with insomnia. And going further, the same consensus panel task force said they made a strong recommendation in favor of CBTI based on a large body of moderate quality evidence from 49 studies, including multiple recent large randomized controlled trials showing clinically meaningful improvements in critical outcomes, patients highly preferring behavioral and psychological treatments, and favorable information on cost effectiveness of CBTI. Now, one thing I mentioned in the behavioral treatments was relaxation treatments. And one of the most powerful relaxation treatments in terms of reducing arousal is actually yoga and meditation, mind-body practices. And there is a strong rationale here for why this should be relevant. Insomnia is associated with hyperarousal of the stress response systems. And these are images from papers published some time ago, but all address this idea of hyperarousal. So in this study, they were looking at poor sleepers compared with good sleepers. They were looking at core body temperature, and what you can see is that the poor sleepers had higher body temperature both during the daytime and during the nighttime than controls who were sleeping well. In terms of corticosteroids, the cortisol stress hormone, higher levels, both during the day and both during the night in insomniacs. Higher metabolic rate, both during the daytime and during the nighttime compared to controls. And then heart rate itself, autonomic drive to heart rate is also higher. And then finally, an EEG study looked and concluded that there is evidence of hyperarousal in the central nervous system. The widespread high power and a broad beta band reported previously during sleep in insomnia is present as well during eyes closed wakefulness, suggestive of around-the-clock hyperarousal. So I want to emphasize that this is round the clock. It's there both during the day and during the night. So what has happened is that there is a shift in the whole arousal system. Your stress level, your chronic stress level has basically shifted upwards, and that is impairing to some degree the quality of your sleep and contributing to the maintenance of chronic insomnia. And so this has been phrased as the hyperarousal hypothesis of insomnia. Taken together, evidence supports the contention that primary insomniacs suffer from a disorder of hyperarousal, and that the elevated arousal produces the poor sleep and other symptoms reported by patients. Treatments for insomnia, such as relaxation, exercise training, and some medications, have in common a shift away from the sympathetic nervous system dominance and towards parasympathetic activation. And so we know that there are mind-body practices, relaxation-related practices, that can be effective for reducing overall psychophysiological arousal. There are studies that have shown that physical exercise alone can reduce arousal. Progressive muscle relaxation, breath regulation, meditation, and then, of course, comprehensive meditative movement practices, including yoga, Tai Chi, and Qigong. Just to show you some of the evidence for these, exercise, just aerobic exercise has been shown to improve insomnia. So this is a forest plot from a meta-analysis. This zero line indicates that the study involved had no change for either favoring the control or the active intervention, the exercise intervention. Everything to the right indicated a positive benefit compared to the control condition. And what you can see in the average, it's on to the right, favoring the exercise. So this meta-analysis supported that. Regular exercise leads to even greater subjective and objective benefits over time, with subjective benefits being comparable to those produced by behavior therapy or pharmacotherapy for insomnia. So turning to another relaxation treatment, breath regulation, slow breathing. This study showed that there's a difference between the benefits of this, and that's manifested in sleep onset latency, as well as in time awake after sleep onset, the time awake during the night, as well as in sleep efficiency. So we can see just slow breathing, breath regulation alone can improve sleep quality. Turning to simple relaxation, the progressive relaxation technique has been used in Western psychology for many decades, and this is a study showing that individuals can improve sleep onset latency, wake time after sleep onset, and sleep efficiency with improvements. And so you can see in terms of sleep efficiency, the active treatment group progressive relaxation went from 85% to 88% sleep efficiency. The control group had no change over time. And then finally, quite a few studies going back to the 1970s have actually shown that meditation practice can also improve sleep. This is well known, and meditation is well characterized as a practice that can reduce overall psychophysiological arousal. And so this is from a meta-analysis of mindfulness meditation on sleep quality, and you can see the studies listed here. Again, another forest plot. Every mark to the right of the zero line indicates favoring the active intervention, which was meditation. You can see the average here overall favors meditation as contributing to sleep improvement. So I've shown you 4 components: exercise, relaxation, breathing, and meditation. Those are the 4 components of yoga. And so traditional yoga includes, of course, asanas, although in modern society there are a lot of yoga practices which are just asanas. However, traditional yoga, holistic yoga, incorporates multiple components. It incorporates breathing techniques, it incorporates deep relaxation, and very importantly, it incorporates meditation. And we're starting to get a deep understanding of the psychophysiology of yoga practices, which has allowed us to create a model based upon research that's been done into how yoga is working on both the mind and on the body. And this is this model. And what you can see in the top box here is that I've got the 4 components of yoga that you see taught and studied in research studies: the postures, the breathing technique, the relaxation, and the meditative component. And we know that from each one of these practices by itself, or together in some combination in yoga, we are improving physical functioning. In this box, I'm calling it fitness. And that's manifested by improvements in flexibility, strength, coordination, balance, respiratory function, reducing physical tension. And through the mind-body connection, as we've seen in the exercise study, we're reducing overall arousal and creating self-efficacy in terms of psychological functioning. It's also through each one of these practices by itself, as we've seen, or together in yoga, that we are improving what we call self-regulation of internal state. This is a classic construct underlying the field of mind-body medicine and certainly of yoga. The ability of these practices to give us the skills to be able to control our internal functioning, self-regulate both physical and psychological functioning. And this is unique in modern medicine because in modern medicine, this construct is virtually absent. In modern medicine, the doctor does something to you. There's no expectation that the patient can make a change by him or herself in their internal functioning. And this is what yoga has that modern medicine has yet to have. So that is very important. And the 2 most important things that we can regulate when we practice yoga are stress and emotion. And that can happen immediately within minutes. And as one continues to practice, changes take place, and those changes become long-term skills that change our underlying basal levels. And that includes resilience and tolerance to stress and increase in emotional equanimity. And what yoga practitioners experience is an increased ability to maintain their stress levels and their emotional functioning over longer-term practice. And this, of course, is an overall psychological self-efficacy. What it's reducing is the risk factors for many diseases, because stress is a risk factor for most mental health conditions. And emotion regulation is at the heart of many mental health conditions. Not only that, but we're also affecting factors which also have effects on physiological and physical functioning, such as appetite, weight gain, even glucose regulation. And then finally, the meditative component of yoga is generating its own changes. Meditation, most simply defined, is the relaxed, non-analytical focus of attention. And when you focus your attention, you are engaging the attention networks of the brain. And those attention networks then have their consequences when you engage them. We know that the attention networks actually have inhibitory effects on the limbic system. And what we see that over time, we see long-term changes taking place, that the attention networks become more efficient, and individuals are able to meditate more effectively. What happens during meditation is that you're focusing on a target, whether that's a mantra or the breath, and then you have an intrusion of mind wandering. And then you notice that your mind has wandered, and then you return the focus to the focus of your meditation practice. And as you continue to do this, mind wandering continuously intrudes. Even the most advanced meditator has intrusions of mind wandering. You can never get away from that. But what you will cultivate is the ability to notice your mind wandering more accurately, return to the focus more quickly and more effectively, and overall develop a new relationship to your thought processes. You come to the realization that you are not your thoughts, that you have the ability to change your reactivity to your thoughts. In fact, you have the ability to change the content of your thoughts. And this realization is essentially referred to as metacognition. Metacognition happens to be the major underlying construct behind arguably the most effective and universal form of psychological therapy, which is cognitive behavioral therapy. And as I've shown you, cognitive behavioral therapy is extremely effective for insomnia. So yoga shares this metacognitive ability with cognitive behavioral therapy. So with continued meditation practice, we improve our mind-body awareness. That's through the engagement of the attention networks. We get better at attending. That leads to basically a synonym for awareness, which is now taking over the field of psychology, this term mindfulness. Yoga indeed increases mindfulness. It also, because you're improving attention networks, you're improving cognitive function and concentration, and ultimately yielding this state of metacognition. Now I'm going to come back to this briefly at the end of my talk, because this whole idea of increasing mind-body awareness may be effective in terms of addressing this problem of sleep deficiency. All those people, that third of the population that's walking around in chronic sleep-deprived condition, is not even aware that they are sleep-deprived. So this increase in awareness can actually be something that will improve, and people will be aware of the fact that they are not functioning properly, and that better sleep makes them function properly, and therefore they will want to sleep and achieve the necessary sleep duration for maintaining proper health. So this model, of course, works very well for insomnia because you're basically reducing this stress and improving emotion regulation, and then maintaining this metacognition. One of the major problems in people with insomnia is negative cognitive activity during the night. People are saying, oh my God, I'm going to be a wreck tomorrow. I'm not getting enough sleep. And that's tossing and turning in the middle of the night. That thought is not conducive to sleep. And so when we are able to monitor those thoughts and get away from the negative content, we are able then to sleep a little better because we're improving that cognitive functioning, that cognitive disturbance. So there are reviews that are summarizing now the effects of mind-body practices such as yoga and meditation. And this study here concluded that the findings of 17 studies showed that mindfulness movement has beneficial effects for various populations on a range of sleep measures. Improvement in sleep quality was reported in the majority of studies. So sleep itself has often been reported as improved in many studies. This is another study looking at sleep in ordinarily healthy middle-aged or older adults. Yoga was the most effective with respect to reporting sleep disorders and sleep efficiency and sleep duration. And that sleep duration is important because, again, we're talking about sleep need. So in terms of yoga practitioners, when we look at long-term yoga practitioners, this is a study that compared them on the Pittsburgh Subjective Sleep Quality and the Pittsburgh Sleep Quality Index. You can see the control group is at 4.25. Higher scores means more sleep disturbance. The yoga group had a lower score of 2.92. So yoga practitioners report better sleep. Furthermore, there's a correlation in long-term yoga practitioners between their practice frequency and their sleep disturbance, such that the more they practice, the better their sleep is. We've seen another survey study in elderly yoga practitioners, and the elderly are more at risk for sleep disturbance because like everything with aging, their sleep mechanisms are starting to degrade a little, so they're more vulnerable to insomnia. And what you can see is a comparison between yoga elderly and non-yoga elderly, and the score on the Pittsburgh Sleep Quality Index is lower, meaning less sleep disturbance than in the non-yoga group, and in a number of other measures, including disturbance, sleep medication use, sleep efficiency, and overall sleep quality. There was a statistically significant difference between the elderly that had practiced yoga and those that were not practicing. Furthermore, yoga practitioners also attribute their improved sleep to the yoga practice. So in terms of answering the question, my sleep is better because of yoga, 70% of yoga practitioners agreed or strongly agreed with that statement. So they attribute that improvement in sleep to their yoga practice. We've also seen this improvement in a number of studies as a secondary outcome measure. So we've done studies on yoga in schools, for example. Our primary goal was to improve mental health, but we also saw in qualitative interviews that sleep was often reported as one of the most immediate benefits. So these are quotes from some of the students in these studies. Yoga definitely helped with sleeping. It would take me a long time to get to sleep. When I was doing yoga, it was much easier to fall asleep and stay asleep. Another said, I think I've been sleeping deeper and more comfortably because also along with the foot on the wall, I also do the 3-part breathing so that I can relax myself before I try and fall asleep. And then finally, another said, yeah, I can sleep a lot better, fall asleep faster. And you can see in this qualitative interview where we had a number of subjects, 16 subjects, 10 of them had a positive impact, reported a positive impact on their sleep. We've also done trials on, in the workplace, and this was a trial in educators, mostly teachers of a stressful occupation with higher levels of sleep disturbance. We saw reductions in perceived stress and improvements in resilience to stress, and that was associated with reductions in sleep disturbance. That was at the end of the treatment program as well as at the long-term follow-up. We've also done studies on post-traumatic stress disorder, another mental health disorder that's involving hyperarousal. And we did see improvements in the PTSD checklist. The PTSD symptoms did go down significantly compared to the controls. We also saw improvements in the insomnia severity index that paralleled that improvement in PTSD symptoms. And more recently, we did a trial of a combination of Kundalini Yoga together with cognitive behavioral therapy, and what you can see is the sleep disturbance scores going down, sleep quality improving, daytime functioning improving, sleep latency improving, and the use of sleep medication improving. And interestingly, there was a correlation between the compliance with the yoga practice and the improvement in sleep, which is not surprising. If you don't do the yoga, it doesn't work. If you do the yoga, it works. The more yoga you do, the better you have an outcome. And then in another trial, this was a major trial with 200 subjects published in JAMA Psychiatry of yoga for generalized anxiety disorder. One of our secondary outcome measures was insomnia, and this is the PSQI and the ISI. You can see the 3 different treatments. There was yoga, CBT, and an education control group. And the CBT and the yoga groups showed greater improvements in sleep disturbance than did the control condition. So what about yoga for actual formally diagnosed chronic insomnia? And that is, of course, a little more difficult because chronic insomnia tends to be fairly resistant. This is interesting. This is a pharmaceutical ad for an over-the-counter medication. And what they're showing you is a yoga asana. And the rationale for this ad is that if you take their sleeping medication, you'll be more alert and awake in the morning and more willing and able to do your yoga. So what I'm proposing is the reverse. I'm proposing that you practice the yoga and then you won't need this silly medication. So we do have evidence that yoga does have positive benefit on insomnia, and this is coming from a review of mind-body studies. Mind-body therapies resulted in statistically significant improvement in sleep quality and reduction in insomnia severity, but no significant effects on sleep quality indices. Mind-body therapies can be effective in treating insomnia and improving sleep quality for healthy individuals and clinical patients. And I want to come back to this point here, which seems out of place, but I'm going to come back to this. No significant effects on sleep quantity. So we've conducted a couple of trials on yoga for chronic insomnia. This first preliminary trial was on 20 insomnia patients. 13 had already been seen and referred by a sleep specialist. 6 of them actually had a sleep study performed, which is very unusual. It indicates that there was real resistance to treatment here. 10 of them had underwent previous trials with hypnotics. In other words, this was treatment-resistant insomnia. So we had them do daily home yoga practice before bedtime for 8 weeks. This included physical postures, meditation, and slow breathing. The investigator interaction on my part was minimal, 1-hour individual in-person training session, and what we measured, our primary outcome, was a daily sleep diary. This is an example of one subject, and this is the sleep diary over the course of 8 weeks. So the first 2 weeks before this beginning of treatment, pink line here, this is the sleep onset latency, and this you can barely see. This is 60 minutes. So this patient was taking over 60 minutes to fall asleep and about 40 minutes on a regular basis at minimum. So the yoga treatment started here. And what you see in the first 2 weeks of treatment is basically nothing. There's nothing happening. And so if the person is practicing yoga for 2 weeks and says, well, I've been doing this for 2 weeks, I got nothing, I'm giving up. Well, what happens by the end of the 8 weeks? You can see that there is this gradual improvement. And by the end of the 8-week treatment, you can see that all of the sleep onsets are less than 30 minutes, which is normative. And so what's happening is what you expect to see happening. You expect to see a readjustment of the nervous system. That takes time. It took time for the insomnia to come into place as a dysregulation of nervous system activity. It's going to take time for that to come back into balance through the act of the yoga practice. And this dotted line is a 6-month follow-up, and you can see that this patient has largely maintained this improvement in sleep onset latency. And we see similar trends in other sleep measures. So total wake time up here is declining again in this gradual trend maintained at the 6-month follow-up. Self-rated sleep quality on a scale of 1 to 5 goes from an average of about 1 to an average of about 4. Here, total sleep time going from only about 5 hours up to close to 7 hours, which is normative. Sleep efficiency way below here, and then up to 90%, which again is normative. So this is what you expect to see when you have a true treatment that is addressing the underlying cause and the underlying state of the nervous system. And so these are the averages from the 20 subjects in the trial. You can see the total wake time during the night dropping over the 8 weeks. You can see the increase in sleep efficiency going up, total sleep time going up, and sleep quality slowly increasing. So, of course, you want to do a randomized controlled trial. This was a pure study of diagnosed chronic primary insomnia. They had to have a sleep onset latency of greater than 30 minutes. We recruited this trial based upon behavioral treatment. That's what the advertisement said. It didn't say yoga. So we didn't get a bunch of yoga enthusiasts. We got people who just wanted behavioral treatment. They were informed that it was yoga on the first day of the treatment. So there was a sleep diary outcome just like the first trial, 6-month follow-up. We had a control group here. It was not an inactive control. It was sleep hygiene with reasonable recommendations. And again, there was minimal investigation. This was a self-treatment protocol. People were on their own to do this therapy. So these are the moving average results. You can see sleep onset latency going down in both groups, and maybe slightly lower in the purple, which is the yoga group. These are the moving averages of the daily sleep diary. Sleep efficiency going from below 80% to close to 90%, and then total sleep time also increasing significantly to 7.5 hours at peak in the long-term follow-up. When we looked at the averages of 2-week windows, you see what we saw in our first single group trial. The yoga group here in the purple dropping in sleep onset latency and well below 30 minutes at the 6-month follow-up. Total sleep time increasing from 6.5 hours to 7.5 hours, and total wake time also decreasing over the course of the study. Another way to look at this was the number of subjects that went from clinically significant impairment to non-impaired. And we compared the yoga and the sleep hygiene group in terms of sleep onset latency, how many had improved their sleep onset latency. In the yoga group, it was 60% at the end of the treatment, which increased to 80% by the long-term follow-up compared to the sleep hygiene group. In terms of improving sleep efficiency to over 80%, that was 80% of subjects at the 8-week point, and that rose more by the long-term follow-up. And the insomnia severity index also showed higher levels and improvement than the control conditions. So we believe that yoga is an effective strategy for treating insomnia. So now I want to bring you back to that quote that I asked you to keep in mind. This statement here, in terms of mind-body therapies for insomnia, that these found no significant effects on sleep quantity indices. Now, this point I'm bringing up because I believe that yoga has something to play here that may be missing in cognitive behavioral therapy. And what is missing in cognitive behavioral therapy is the ability to improve sleep duration. So this is a meta-analysis of cognitive behavioral therapy treatments. And what the outcome is that they're looking at is sleep duration. And again, the zero line means that it's not favoring either the control or the treatment group. And the average is barely favoring the active intervention, suggesting that basically cognitive behavioral therapy, although it improves sleep efficiency and reduces wake time, it doesn't really increase sleep duration. Now, this is important because, as I've shown you in the early part of my talk, sleep duration is important. So it may be important to these insomniacs as well. They have improved their insomnia, their sleep disturbance, but maybe not have reconstituted their sleep duration. So this brings me to the results in our randomized controlled trial. And what you can see is the sleep onset latency in our trial was a reduction of 17 minutes in time. That is about the same as the meta-analysis of CBT, 19 minutes. The sleep efficiency in our trial improved by 10%. The CBT meta-analysis improved by 9.9%, pretty much the same. Here's the difference. Our total sleep time in the yoga intervention increased by 65 minutes. In the meta-analysis, 7.6 minutes. So here is where yoga can add something that CBT does not provide, and that is the increase in sleep duration. So this needs to be verified, and the way to do that was the larger randomized controlled trial. So I want to just point out a couple of future directions. One of them is that most research studies use a one-size-fits-all treatment. And yoga therapists complain about this, as they say, we don't do yoga that way. We tailor our yoga intervention to the patient. And two different patients with insomnia might get different treatments based upon their characteristics. So they argue for tailored interventions, and that is perhaps a future direction for research. There is one paper that has actually looked at a tailored intervention for insomnia. So this is using this technique, and what they found is pretty much improvement in a number of different measures. So the tailored measure does improve sleep, and we need a study that compares the tailored measure to the one-size-fits-all measure. Then finally, the other thing about we can do forward is that, you know, when you combine two medications together, there's potential of medication to medication negative interactions, so you have to be careful with pharmaceuticals. The same is not so true with behavioral interventions. We can add two behavioral interventions together. So why not add yoga together with CBT or meditation together with CBT? And some of this work has been piloted by Jason Ong at the University of Chicago. And what he's done is he's added mindfulness practice together with cognitive behavioral therapy in a blended treatment. And what he found, indeed, was improvements that were pretty much equivalent, if not slightly better, than the treatment alone. And that is manifested in this trial that was actually published in the journal Sleep. And what they did was they created a mind-body treatment for insomnia, MBTI, and compared that to MBSR, which is a well-known stress reduction intervention. And what they showed is that the addition of those sleep-specific cognitive behavioral therapy aspects really improved the reduction in sleep disturbance compared to just the mindfulness-based relaxation treatment. So here's a direction for the future to add yoga together as an enhancement to make a stronger a CBT intervention, and that may perhaps add to the improvement in sleep duration that is missing in conventional CBT. So I am funded and work closely with the International Association of Yoga Therapists. I coordinate the International Journal of Yoga Therapy and run the Symposium on Yoga Research, and this organization accredits yoga therapy schools and certifies yoga therapists. I also work with the Kundalini Research Institute as Director of Research. And I want to draw your attention to our medical textbook. The promotion of yoga in medicine is very important to me, and we've published the second edition of this book, The Principles and Practice of Yoga in Healthcare. This is a medical textbook, 576 pages, and it includes 100 international yoga researchers, many of them from India, all the leading yoga researchers. We have 17 chapters in this book reviewing yoga research in physical and mental health conditions. And we have also included the voices of 40 international yoga therapist contributors. So this is our face to modern medicine, arguing that yoga has a place. It has things to offer that modern medicine simply does not have at this point in time. And just to give you one example, chronic stress. One of the biggest challenges in modern medicine is burnout and chronic stress. You don't have a pill for that. Yoga is very good at that. So here we have something that you don't have. The other thing that we have in yoga is this increase in mind-body awareness. That can change behavior. That can change lifestyle. And modern medicine is very poor at changing lifestyle, and that's important because the major burden in modern medicine is lifestyle disease. So yoga has two aspects that are critical that modern medicine is in need of. So hopefully this kind of book can bring to light the credibility of yoga, that yoga has undergone a good deal of research that's growing in strength in both quantity and quality. I also draw your attention to this book on yoga for mental health. In this book, we've also reviewed exactly what I've shown you today in a chapter on insomnia. So I'm going to stop there and thank you for your attention. I'm happy to answer any questions.
Thank you, Sadhbir, for a very enlightening talk. We have some time for a few questions. You can just speak up from there or you can come here and ask. Yeah. Do you want to come here? And you can. Okay.
I'm pretty audible. Yeah. First of all, it was a wonderful talk to go through it. I have two fundamental questions. Because when you're looking at yoga, you are looking at a complete integrated picture of the body and the response. Have you anywhere studied or you found in your research that diet also has a severe impact on your pattern? That's question number one. And secondly, most of your data has come from the West, where the socio-economic status and the challenges are quite different than this side of the world. So have you seen a difference in the pattern of responses to your therapy or your outcomes?
What was the first question?
About the diet.
Diet. Oh, diet. There is a growing body of very amazing research that's been done in sleep medicine with respect to dietary intake. Not only the content of the food, the type of food, but also the timing of the food. For example, it was shown in a recent study that those people that eat within 6 hours before bedtime gain weight, and that those that refrain from eating actually lose weight. So diet has a very important impact in terms of sleep quantity, quality, and sleep regulation. In terms of insomnia, we're all humans, whether we're in Asia or in North America, and I think the outcomes will be the same. There are a lot of studies done in India. It's one of the leading, it is the leading country in terms of yoga research. And we see routinely and universally that yoga can improve stress and emotion regulation and mindfulness in studies here as well as in the West. There are a few studies that have been done here in India. And one that comes to mind immediately is Shirley Tellis, who did a study with elderly and showed that a yoga intervention increased total sleep duration and reduced sleep disturbance. So we have a few studies that have been done in India showing improvements in sleep quality and quantity here.
Is this problem inherited? My father had this problem and now...
Yes, there are some characteristics that have been transferred. In fact, it comes along with personality condition. I mean, if people are more arousal oriented, more emotionally oriented, they tend to be more at risk. And there is good evidence that there are some inherited characteristics that certain individuals with a certain history, family history, are more susceptible to insomnia. So yeah, there is some evidence. It's not a huge effect, but it's definitely there.
Is it good to have melatonin tablets if I don't get...
Well, yeah, there is a field of research that's looking at melatonin. I again prefer behavioral treatments because, again, this is just another pill. And the melatonin that people are taking, this is not at endogenous levels. The melatonin doses that people are taking are 100 times greater than what we see inside the brain. And so, again, it's another pill approach. And to me, that is not the solution. The solution is to address the true underlying problem, which is the stress regulation issue. So yeah, and it's the same with hypnotics, you know. And one of the things with hypnotics, for example, that really is interesting is that, yes, they may work. A patient may have chronic insomnia, take a sleeping pill, and they're sleeping fine. So they take the sleeping pill for 10 years. And then they say, I'm tired of the sleeping pill. They stop taking a sleeping pill. Their insomnia comes back exactly to where it was when they started taking the pill. Nothing has changed. They have not changed their nervous system or rebalanced things. So to me, this is critical, because I think the most effective treatment in medicine is not to just treat the symptoms, but to treat the underlying cause, because this is true cure, not just symptom treatment. So I prefer behavioral treatments over pills, whether these are hypnotic medications or melatonin.
One last question, because we have to vacate the hall. There is another program here at 4 o'clock. One last question. Yeah.
Are there any specific asanas that we recommend?
So the question is, are there any specific asanas? Well, if you go to the yoga literature, yes, they are. In different yoga lineages, different yoga masters have said, you practice this for insomnia. Another one said, you practice that for insomnia. The only one that I've seen that has some sort of universal construct across different yoga styles is what's called bridge pose, Sattvandasana. And you can do this either as table pose or as bridge pose on your shoulders, elevating the navel point up high and then doing slow breathing as you do that technique. I personally have found when I have occasional insomnia, if I do that, it will give me benefit. But it's difficult to do. It's a challenging posture. So a lot of people aren't going to do the athletics necessary to merely manifest that. And I think that slow breathing is really potent. I think, and I showed you that one study, but I think a lot more studies need to be done to show the efficacy of slow breathing. And slow breathing, how easy is that? You just slow your breathing down. You don't need any tools, you don't need any instruments, you don't need a yoga mat, you just slow your breathing. And that, I think, is turning out to be a very, very powerful mind-body practice.
Thank you. Okay, the last one.
Which time yoga practice is better for treating the insomnia, daytime or just before?
So the question is, what time is better to practice yoga for insomnia, bedtime or wake time? And we don't know the answer because we haven't done the study. If I can get the funding, I would do that study, but I'm not going to get funding, so I can't tell you. But I can tell you that it may not matter, because when I showed you those figures of arousal, all of them were both during the day and both during the night. It was not just during the night. So that means it's a global level of arousal. So as long as you can lower that global level of arousal, you will have benefit. So does it matter whether you do yoga in the morning or evening to lower global arousal? No, probably not. So my hypothesis would be it wouldn't matter. As long as you reduce global psychophysiological arousal, you're going to get the benefit. But of course, we need to do the study.
May I request Dr. Pramod to please escort Dr. Prabhakar to honor Sadhbir, if you can come here, and Purva, may I request you to hand over a small token of gratitude to Sadhbir. Thank you for a very enlightening talk. Can we have a good applause for him? And Pramod, may I request you to give a quick vote of thanks, and we can wrap up.
Thank you, Dr. Akshay, for giving me this opportunity to present the vote of thanks for this wonderful talk organized by the Department of Neurology. At the onset, again, I would like to thank the Director PGI, Professor Vivek Lal, who has been instrumental and always enthusiastic and helps us organizing these events time and again, and for his constant support as well. And I would like to thank the deans, both academic and research, for their some of their valuable inputs in organizing this event. At the same time, I would like to thank once again Professor Prabhakar, who is also the former head Department of Neurology, as well as the additional Chief Secretary in the Government of Punjab, who has made from his valuable time to be present for this event. And once again, I would like to thank Dr. Sadhbir Khalsa for providing an insight and complete different dimension of how to look at the sleep related pattern and the sleep related cycle, as well as which again further being more chronic leads into the insomnia conditions, and how the intervention of yoga for taking the help of the four important points which are the part of the yoga would help improve the quality of the sleep. At the same time, one of the concepts of the Kundalini Yoga has also been presented. So if you look very carefully how yoga has been part of this studies in insomnia, would also been supported by lot of the evidences across the globe. And it was very interesting during the one of the discussions with Dr. Khalsa in the morning hours, where he has even when we talked about, he has given an overview of how the yoga practices are being helpful and are being taken up more actively across the globe, whether it be from the Middle East, Iran, Turkey, or from Europe, studies from France, Australia, etc. And that was more insightful, and very thankful to you for even giving us this approach of how the situation of yoga and yoga practices are being perceived across the globe. Thank you, sir, once again for providing this insightful talk, and I hope that all of you who are present for this talk, one and all, both online and offline, I know that this has been an interesting talk, and you have some of the underlying take-home messages for you, and even the how helpful is the yoga practices. And last but not least, once again I would like to thank the Department of Neurology, as well as the CCR1 Center for Collaborative Mind-Body Medicine through Yoga Center at PGI, who has been part of the this in organizing this talk. Thank you once again. Thank you all.
As you vacate the hall, Dr. Sadbir will be available outside. You can chat with him, interact with him. So the next session about to start. Sorry about this being very short. Thank you.